ChatGPT sold us. Like, I couldn't even sell us as good as ChatGPT sold us. 2 years ago, I said, Supreme is not for everyone. I said that. Why did I say that?
So if you're doing guided surgery, you're pretty much just drilling where you thought everything was, but there's nothing like a freehand surgery where you can actually feel the bone, see where you're actually drilling,
and you can feel the bone density.
Especially if you want.
And he asked ChatGPT if Supremedental was a premium clinic here in Mexico, and ChatGPT responded back that
finally the most important for us is the torque, and the torque depends on the technique.
Yes.
If you are using a special technique to put the implant in a perfect position with a perfect torque, is the most important.
Even though we love our patients, we love to see your beautiful faces and your beautiful smiles, we don't want to see you guys back here because something broke or something went wrong. Believe me.
The patient that I just did the all-inclusive package, she was quoted $60K for snap-ons.
Snap-on dentures.
No, yeah.
We need to up our prices. Welcome back to Supremedental Podcast Studio.
Estos son podcasts, no chingaderas.
You can be anywhere else in the world right now, but you're here with us.
The level of mastery you have on dental work is extraordinary.
Do your research. Perfect.
This is the podcast.
Welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supremedental Clinic. Listen, we're on Apple Podcasts and we're on Spotify. And today we have Dr. Lee's, Dr. Lies. How you guys doing?
Hello, Frank.
We're doing great, Frank.
Welcome to season 3
Thank you for having us.
of Supremedental Podcast.
Is this episode 1, season 3, or
This will be episode 1, season 3.
Season 3?
Yeah. So
we're there?
How many years? How many years do we have here?
this is what, our second year?
No, we did 3 more episodes last with the kids.
Those will come out after this. This is the first one that we're gonna do. Well, I don't know. Well, this is one of the new podcasts on season 3. How about that?
Is the first?
The first with you guys.
How many episodes
with us.
are we in
With us,
now?
yeah.
What's our episode count?
Almost 100, I think.
Almost 100 episodes.
Oh, congratulations.
Yeah.
Congratulations to you.
Congratulations
Congratulations to both
to the
of
whole
you guys.
team.
Congrats.
To the whole team.
Yes.
We changed some lighting, so we want to give a shout out to Mr. Walter.
Yes.
How do you say his last name?
Oh, I don't want to butcher it.
Oh,
I don't wanna
we
butcher
got to know his last name.
Yeah.
Oh man,
I don't wanna butcher
How are we
it.
gonna do that?
Except,
You gonna put his name down there? Okay.
He was a great patient of ours.
Yeah, and he happens to be also a lighting producer,
And he's a director as
a
well.
lighting director
Captain
for
Marvel.
and
a couple of great
and
movies.
Kong, the movie Kong.
Yes.
and also for like throwbacks videos like Gin and Juice and Cry Me a River with Justin Timberlake, Britney Spears.
Wow.
I mean, you name it. This guy's been in a lot of places, and he came actually in here, and I have a picture. We'll put the picture of him right here, George. And he was here with. He just looked at our podcast and he said, "We got to change the lighting. It's really bothering me." That's what he said.
Yes.
He goes, "You're really into clinical, and this is more of non-clinical doing your podcast. So we should change some things." And we changed some things, and we're gonna keep on changing things. Obviously, he was talking in a different language, but it's pretty awesome. So we want to give you a shout out for that. Thank you so much.
Yes. Great patient. Great patient.
We don't want to butcher your last name, so we'll just put it down here. But thank you so much. Today, guys, I want to talk about there's just dental just like the world is just a different place. A year ago, 2 years ago, 5 years ago, last month,
Yeah.
everything is just changing, and so is dental. So we want to talk about different trends. So right here, according to Soft Smile, there's so many different things right now. One of the things that patients are talking about the most, it's about 3D printing technology. So it says right here, many dentists felt it was still a few years ago away from adoption, except those few years have now flown by. So now they say it's a $9.5 billion market. So what do you guys think about the 3D printing, and how is that helping right now on the day-to-day to be able to help us do the best for our patients?
Well, I think now with the new technology, we have the opportunity to create new designs on the software. After the software, we can print. We can print the any structure, any prototype. It can help us to check any smile, to check any dimension, to check the position, to avoid any problem with the permanent. It's a great opportunity to create a better smiles.
Yeah, I think digital dentistry has really evolved fast, and 3D printing has been on the market for a couple of years. I personally have been 3D printing for more than 5 years now. And it, like,
I invented 3D printing.
I brought
he said.
3D printing to Los Algos. No, I'm just kidding. But I did buy my own 3D printer when I first started doing surgical guides, and you can 3D print models. You can 3D print skulls. When I first started,
Oh, no, yeah, I remember.
Yeah.
and when I first started looking into pterygoids, I would get the CT scan and actually bring it to life and on a real size when I 3D printed from DICOMs to STLs, and I could print it and I could practice the surgeries before we actually did them. So 3D printing has made everything faster. We can actually show the patient, like Luis mentioned, the prototypes.
The prototype. Yeah.
So it's really for on the medical side, not just dentistry. It's really been a game changer. 3D printing for sure. It's fast. The 3D printers have gotten really fast. When I first started out, they would take a little bit longer, but now Frozen, Anycubic, NextDent have really stepped up their game, and Asiga, they have really stepped up their game. Now there's the resin that's biocompatible that we can actually take into surgery or take into patient's mouth. We're now 3D printing even immediate loadings as well. We don't 3D print. We do a milling, which is stronger, but we can also 3D print that, which is just amazing, everything that you can do.
You know, and when back in the day, not too long ago, we were taking impressions on patients' mouth.
1 year.
Yeah,
year ago.
year and a half. We were taking impressions, and then how many times did we get that back? Something went wrong. I don't know if it's the guy the lab that came to pick it up, and he smushed it a little bit with his backpack. Whatever it was, it didn't look as professional. And now we have like the Asiga, which is the number one most accurate printer in the world. We have the NextDent, which is the fastest printer in the world. We came light years away from where we were at, and it's kind of hard to understand how we used to work with it before. It's like I feel like you get real used to good things real fast. Once you get a hold of something and you understand it, right?
Yeah.
You're like, how are people still not using it? Because it does make a world of a difference, especially in the digital life. Overall, in the digital world, you need to scan digitally to then print and have that, everything done digitally. Because if you take the impression, then, where's your digital outcome going to be? It doesn't make any sense. Like you went with one of the trainings and they were still taking impressions.
Yeah.
And they were talking about digital. And you're like, well, why isn't that digital?
It wasn't full digital, yeah. It was only semi-digital.
It's like semi-digital. We have one of the things here that most patients talk about, okay? It says AI-powered treatment plan. So it says in 2025 is no longer limited to diagnostics. It's now playing an active role in how we plan treatments. What do you guys think about AI? And we were just talking about that right now because Manny was here. And we were talking about how do you believe that AI will play a big factor into diagnostics to patients?
I think we're not there yet.
Yes, not yet.
Not yet.
Yeah.
I think it's really revolving fast. I think what AI really helps out is a consultation, but not actual physical work.
Yeah.
I've actually tried it with ChatGPT. I have the subscription, and I still see that even if when I ask it like really simple question like who created the Patsy protocol, which it's something fairly simple,
Yeah.
it would say somebody else did it. It would say Carlos Aparicio did the Patsy protocol, and I was like, hey, you know what? It was actually Juan Gonzalez and Dan Holtzclaw, and he's like, hey, you know what? You're right. So I think there's still a lot of things.
Still learning.
Yeah, it's still learning. But as far as treatment planning, I think we're not there yet. It can give you options of what you have and what you can do. Because what we've done lately is that we take pictures of our CT scans or of our x-rays and we tell it, hey, what do you see here? and it tells us, oh, I can see pterygoids, I can see zygotes, I could see, and it does give you a pretty good idea of what you're actually looking at. But I think for like the actual work, the actual surgeries, it's still not there yet. What it has also helped us out with, which brings me to another point, which I was really upset last week. You know, we get a lot of heat from dentists in the U.S. that cannot compete with the quality and the pricing. I don't know if I should bring it up or not.
Go for it. I might just put my phone down because I was gonna do something, but go for it. Go for it.
And which I understand if a patient comes down and gets the work done, I know that they're gonna be a little upset that they came down and got the work done, and then they're gonna go ask their U.S. dentist if the work is properly done, and they're obviously gonna try to pinpoint ideas that it's not ideal or whatever, which we're used to that by now, and we can show X-rays and whatever.
Underdogs.
Yeah, we're always underdogs. But what I thought was very low is that we had a patient, one of Luis's patients, that I did an implant, and I placed a Straumann BLX implant, which is the
I remember I showed the
one of the many implants that Straumann offers. Yeah.
Yes, but this is like the latest implant that Straumann offers, right? This is like the best line of implants that they have. So he went back to his U.S. dentist, and the U.S. dentist took an X-ray, and the U.S. dentist didn't know it was a BLX, and he told the patient that we had ripped them off, that it wasn't a Straumann implant.
Straumann is new, and how many years have?
Over 65 years.
Over 65 years.
65, yeah.
And
But BLX,
but BLX has been in the market for more than 6-7 years now.
6-7 years. Okay.
So, and he told them that it wasn't a Straumann implant, right? And he's like, oh, you know, they ripped you off. It's not a Straumann implant, because Luis had placed on the upper arch a BLT Straumann implant.
Yeah.
So which is a different brand. I mean, if you have different bone qualities, Straumann gives you options to have different lines of Straumann.
He's like, it's not a BLX, it's a PLX.
So, and he came down and he was very upset, and he didn't want to see me because I ripped them off. I didn't use the Straumann implant because his dentist in the U.S. told him it wasn't a Straumann implant. And I was eavesdropping. I was like really upset, you know, like we don't do that here, you know?
Right.
We don't do that here. And Luis was, you know, he had a bright idea.
I'm gonna show you the AI. I'm sorry,
ChatGPT.
to show you the company, and I take the picture. And I show the company. It's VLX.
So AI, you took a picture with the AI application, and AI application
ChatGPT.
with ChatGPT, and the ChatGPT sees the picture and automatically tells you,
like this is
Straumann.
next, yeah,
The
Straumann BLX.
Straumann BLX.
And his son was there, which he was a little more tech savvy, and they were like, you know, which I mean, that was very low. I thought that was very
I mean,
low.
I've seen low, because automatically I tell our patients, when you go get checked, because a lot of our patients want to go get checked back, even though a lot of them trust us, but they want to go get checked, right? I said, don't tell them it's a doctor from Mexico. Just tell me I got my dental. Well, where'd you get it done? Oh, I got it somewhere in the States. And they're gonna tell you, oh my God, where'd you go? I've heard a lot of patients say, did you go to that? Do you go to that Beverly Hills dentist? Is this something that they do in LA? You know, people that are like more on the East Coast. And there's like, once they say everything is good, he's like, no, it was done in Mexico. And now there's no way of going back from that. They can't say, oh no, never mind. But if you automatically start, hey, I got my dental work in Mexico, automatically some of the dentists in the United States will be like, well, let me take a look, because I heard some horror stories. And, you know, they're not really giving you their opinion. They're just giving you what, you know, and there's good dentists and there's bad dentists everywhere. We're gonna say that. There's bad dentists here in Mexico. I mean, I could tell you 100%. And there's people that like to, if they can do something, they like to talk about what they can do. Like, for example, pterygoids or zygomatics, how, oh no, that's too invasive. They shouldn't do that. Well, if the patient wants teeth, what else do you want to do? And obviously, we didn't invent them, guys. You know, we did not invent. Even though I would have wished we would have invented it, we did not. I would not be here right now. We did not invent those type of implants. We're just top dentists worldwide are doing it. And nowadays, you hear a lot more pterygoids. You hear a lot more zygomatics. I think the world is going to, now we know that an all-on-4, for it to be an all-on-4 for a very long time, an all-on-6, you want to do pterygoids. You know, and I believe Michael Picos is the one that came up with that. He said that every all-on-4 that he believes in the upper, depending on the situation, but it's perfect anchoring for the pterygoids. So we're not making this stuff up, but it just blows my mind. And I love proving people. I mean, look, listen, if I'm wrong, I'll say I'm wrong. I'll admit I'm wrong. Like back in the day, look, not too long ago, and just real quick, not too long ago, let's go back 2 years in time. 2 years in time. 2 years ago, I said, Supreme is not for everyone. I said that. Why did I say that? Because there's a lot of clinics out here that were selling extremely cheap. And there's patients that are looking for just the cheapest price, not for the highest quality, not for quality overall. They're just looking for the cheapest price that takes care of their problem. And I said, Supreme's not for everyone. Supreme's for those that does the research. Supreme's the one that does for all that, right? Do your research. 2 years later, now I could say that Supreme is for everyone. Why can I say that? Because Supreme now has their own lab. And now Supreme can have, when you go to the dealership, there's still the cars that you roll up the window like this. They're brand new, 2025, you can still roll up the window like this. Why? Because there's that patient that wants that car just to get from point A to point B. And then there's that guy who's single, no kids, and he wants TV screens in the back seat.
Luis.
That's Luis, yeah. And he's not gonna sit in his back seat and watch TV. Yeah, he's like, I have a BMW bike, and
2.
yeah, 3. And so so overall, why does the patient need the TVs in the back? Because he wants to have the best, and he can afford it. So now we have, a package that is, the essential package, and then we have now the all-inclusive. And why did we do the all-inclusive? Because we want people to have peace of mind. What if I need bone grafts? It's included. What if I need IV sedation? It's included.
It's included. Yeah.
What if I get there, Dr. Elias, and instead of 4, I need more implants? It's included. Now, just like any place that's included, there's exceptions. If you go to Grand Velas Hotel, shout out to Grand Velas, see you there in a couple weeks, there's the yacht, and then there's the helicopter. If you want the yacht, you got to pay. If you want the helicopter, you got to pay. Everything else, it's included.
It's a big plus.
It's a huge plus.
Yeah.
So here, the only thing that's different is if you want zygomatics or pterygoids, which not even perhaps 2-3% of the dentists around the world can do. If you want that, we got that for you.
Less.
Or less. But it can be done. Yeah. But everything else is included. We're talking about like the lead therapy. We're talking about the immediate loads. We're talking about IV sedation. We're talking about the Botox on the masseters. That's a huge plus because now when you bite down, it's not as stiff and it helps you relax your muscle. We have the IV treatment for you to feel, you not to be dehydrated because of your flight. I mean, we took care of all those things, all those things. And also you get part of that. A lot of patients like to have their before and after pictures professionally taken. We have a professional video done by Mr. Tejas here. A lot of people like that, to have that transition. All that's offered in one package. So
less is more.
Well, there you go. Less is more. And more than anything, it's okay to be wrong. But it's not okay to lie.
Yeah.
Lying will never be okay. No matter what industry you're on. If you're selling pizzas, if you're whatever it is, you cannot lie. Because if you're lying, then people tend to believe their own lies. And people that believe their own lies become dangerous. Because they're lying to themselves. Who are they? If you're lying to yourself, who the heck really are you? If you are telling the patient that is not a Straumann implant, well, that's your opinion. But what is based off on your opinion?
Yes.
Like, what did you base off of? Are you 100% or you're just blah, whatever comes out to your mind? Blah, it just comes out of your mouth, And that just shows you that type of work that doctor's gonna do,
or the type of morals that he has.
The type of person that he is.
Yes. Which you're willing to lie to a patient, which is...
Yeah, he took away that patient's peace of mind for a long time.
Oh, yeah, and he was upset. He was really upset. But after Luis showed him, he was...
Yeah.
He didn't know
it's not my opinion. I'm going to show you the technology.
But it makes you think how many patients from not just here, anywhere in Mexico, go to the United States and they lie to him. And they said, Jesus, I should have never gone back. I should have never gone to Mexico.
Oh, for sure. Yeah. A lot of people.
And it's BS. If they can't compete with with there's dentists that have great quality, but the quality that they have, the quality that we have. Let's say that we find a clinic that compares to what we do. I promise you'll be a lot more expensive.
The patient that I just did the all-inclusive package, she was quoted $60K for snap-ons.
Snap-on dentures.
No, yeah.
We need upper prices. That's what it boils down to. I'm telling you, one of you guys or both of you guys got to go get a degree in the U.S. Remember, we talked about this.
Yes.
Open up in Yuma, take over.
Put up in Yuma.
Open up. Everybody wants to come down to Yuma.
Go ahead.
So another thing that I want to talk about real quick is, there's everything is going to technology. ChatGPT, AI diagnostics.
The supermarket now.
What happened to the supermarket?
We don't need any cashier. No,
We don't need cashiers.
There's the computer. You can pay everything. Yes.
Everything. I mean, we got Teslas that drive themselves.
Yeah.
I think everybody becomes more and more lazy. Like, I'm going to tell you 100%.
Yes.
Back in the day, I used to love going to the supermarket, whatever store, to go get some food, right? I always ended up taking more food than what I needed because you see stuff and you're hungry.
Right.
You can't go hungry. And now we use the system that they could take it to you. First was your car. You had to drive. And now they take it to your house. So, I mean, you do save some money by them taking it to your house, but you take that person-to-person contact away. So my kids, I took them to the supermarket.
The human touch.
Yeah, the human touch. I took them to one of the stores in Yuma to go shopping for food. One at a time. I mean, just some random stuff. We had food at the house. It was like a toy store to them. Like they were running around the halls. They were looking at everything. Oh, mom, this. Oh, mom, that. Dad, look at this. And those people like looking at us like, what the heck are these kids like? Why are they excited about
All
like
excited about
milk? You know what I'm saying? They were like super excited.
At fries.
That was actually Del Sol. It was even more Mexican, and it was like they were looking at stuff and there's little toys over here because they're not used to that. And sometimes because we don't have the time, I'm not gonna say we're lazy, but we don't have the time. Sometimes we use those things and then we forget. But one of the things I want to talk about is the use of AR and VR to reduce anxiety. So it says right here, dental anxiety is one of the most common barriers to treatment, and we're finally getting better at addressing it. In 2025, clinics are turning to augmented and virtual reality to help patients feel more controlled. VR headsets can now immerse patients in calming environment during procedures, and it's working for older people, pediatric dental clinics across the United States. It talks about projected animated films or visual cues to calm patients down. What do you guys think about that? So, I mean, the patients there, you got your VRs on. You could be looking at an ocean. Do you think, what do you think? What do you guys think about this new technology? Because now everything is technology. Everything's to do with technology. I know we get a lot of patients that put on their headbuds, and then we got to tap them when we have to tell them to open.
Yeah.
But what if they had that big VR there? What do you guys think?
I think it's a great experience to
Have you ever done VR?
Yes. To visit, for example, another countries. Yes. The views looks very, very natural, very real.
I'm sorry, Liz, but you're BSing, bro, because you go to other countries all the time.
Well,
He's like, yeah, I VR to feel like
I'm in Singapore.
I VR.
I am in Singapore.
I VR to my house. He goes, because I'm normally not at my house.
I would believe that.
He goes, so when I'm in Singapore, I put them on or in Greece.
Or Mykonos. Or Florianopolis. Or New York. Or Switzerland.
Or Switzerland.
Or Japan.
Or Brazil.
Or Brazil.
Yeah.
Yeah, Mr. Worldwide, man.
Or Punta Cana.
So what places have you visited with your VR?
Mexico
Because
City.
I work in supremedental.
Wow. This commercial was brought to you by Supreme Dental Clinic. So
Fun. Okay.
Where have you gone on your VRs? Just like space.
My experience with the VR, I remember that in the beginning.
Mochi, Sinaloa.
No, it's Jurassic Park. It's a Jurassic Park world.
Okay, Jurassic
It
World.
looks wow. I remember it's the animals looks real and very close to my body to me. It's a great experience, but I think after 20 minutes, 30 minutes, my mind is like confused, difficult, very difficult. But
Yeah, that's why it's only for a certain age, right?
yeah,
Like you just whatever kids can do it. What about you? What have you done in VR?
I really haven't done a whole lot, if I'm honest with you. I've done the PlayStation VR,
No, that one's ghetto. I think I heard it's pretty ghetto.
but I don't know how it's gonna work in dentistry because sometimes you want the patient to be relaxed, but you want the patient to actually kind of know that they're there at the surgery or at either if you're prepping a crown or a veneer or whatever, because you want them to have their mouth open, and sometimes they're too relaxed and they tend to close. Or if they feel something, they're gonna jolt because their mind's in a different place. So I think I kind of want them to be relaxed, but I kind of want them to know that they're there as well. So
Look,
I don't know.
I'll put a video up. My wife and I and my little girl. I mean, my whole family. We went to Vegas last week. We were at a couple of concerts. We went to the Manny Pacquiao fight. Amazing fight. It was robbed.
Sphere.
And the Sphere, Backstreet Boys, amazing
Boys.
concert at the Sphere. But we also, on our way back, before we came back, we went to the VR for Squid Games.
the picture.
And you got to actually go into Squid Games and play Squid games without actually being shot. My wife, my little girl, and I, and it was an experience. It was an experience because
You were using a special tool here.
tools here and in my feet,
And yes.
and then something here in my chest, and then I had the VR and this. So if I needed to take a coin, I could actually, when I would look at my little girl and my wife, they were avatars. They were next to me, but they were avatars, and they were wearing the whole Squid Game stuff. And they would see me as whatever avatar I chose to be. It was like a bald dude with tattoos. And I would grab the coin, and I would take the coin to the little pig thing. And I have a video, because I have a video of me, what I was doing in real life and what it looked like in the VR world. And it blows your mind because it does take you somewhere else. I could see how it, maybe we should try it. We should try it. We should get a VR here, and we should try it with patients' experiences. One day we prep them up with the VR, and the next day we prep them up without. And we do out of 20 patients, 10, 15 patients.
Little survey.
We'll see a little survey if they like the VR with the headphones or if they like without it.
Stroman has a VR to put implants or bone graft. Yes.
We saw that. We saw that, but I don't really know
Yeah.
how it really works. There's
It's VR. Yes.
there's another VR that's called Navi Guide
Not big guy.
that uses like the CT and you match it and it's actually like kind of showing you where you are.
Mm.
But I think for the remote anchorage techniques, I think you do have to have that little feeling that
Oh, okay.
I don't know if it works that great. We have to try it out. Obviously, we have to try it out. Like it's like everything with technology. Sometimes it comes out and you need to do this. You try it out, works, doesn't work. We need to see what the patients actually tell us.
And I'll go ahead and take that screenshot and I'll send it to you, George. But during last week, the magic about being one of our agents here at Supreme Dental is that they can be anywhere. My wife said it best. The world is my backyard. The world is my office. So they were on a cruise. I think they went to Honduras. They went to Cozumel. They went to the Bahamas. Ernesto and Jessica and their little girl for their 15th birthday. And one of the patients that came in, and I told you guys about it, but I didn't say what patient it was. One of the patients that came in with one of you guys, he came in for a consultation. Okay. He came in for a consultation, and that's all he wanted, a consultation. But when he was here, he liked the way that one of you guys, explained everything. And he asked ChatGPT if Supreme Dental was a premium clinic here in Mexico. And ChatGPT responded back that for the quality that he was going to get here, no one here in Los Algodones compared to that. And he decided to do it. And that's how much our patients are now relying on technology. We had another patient not too long ago that asked Gemini, which is like the ChatGPT, but for Android. And same thing, ChatGPT, he asked them, what are the top dental clinics in Los Algodones or in Mexico? And we were named as one of them. And it says why? That if you're looking for the latest technology with the with dentists that have, worldwide pedigree, that it would be the place to be. And as patients rely more on ChatGPT and about an artificial intelligence, I like it. I like it. I'd rather ChatGPT that's based off of what they see on the web tell you than some pickers on the street just take you somewhere because they're getting money off of it. Because ChatGPT is not making any money off of it. So I'd have to say, and I'll post it up there, and ChatGPT sold us. Like, I couldn't even sell us as good as ChatGPT sold us. We did a little thing. Jessica asked them a question. I think she put a promotion, the all-inclusive promotion, and if it was worth it. And ChatGPT just sells us completely on how based there's other clinics that might be a little bit cheaper but don't include this and this, and why this and this. It's actually something that's going to make your experience a lot better, and it's going to be a lot better for your work overall in the long haul. So I was completely impressed. I wouldn't be able to pay ChatGPT or AI because it'd be extremely expensive. Wink, I'm just kidding. But it's awesome. It's awesome what they're saying. So I'd rather our patients do their research with them sometimes, I guess, than go out here and somebody tells you, hey, my friend, come here. I got it for cheap, 2 for 1. And then what? And then the patient, we were having a meeting yesterday, and we were talking about patients that have gone somewhere else, and that they've gone somewhere else because they were told, they were promised the world, the sky and the stars. And then next thing you know, they call us back. Hey, remember me? I called you 6 months ago, a year ago. You were right. My teeth fell out. You were right. I needed pterygoids. Because people get offended. Oh, why do I need pterygoids? Nobody's ever told me that. Well, nobody who? Like, did you go to the dental clinic that told you didn't need pterygoids? Well, yeah. Did you go to an implantologist and he told you? Well, no, but he's a dentist. It's like they're fighting reality, and we can't. There's virtual reality, but we can't fight reality. And then they end up coming back, and now it costs more because now we have to see if we can even fix what they did, or if they have enough bone structure, perhaps, to do certain things. So, so with that, what do you guys think? Real quick to wrap up, what do you guys think about? So we talked about AI. We talked about virtual reality. We talked about there's a while back I sent you guys I think exactly last year around this time I sent you guys a robot that puts implants. Yeah. I don't know if you guys and the people that were selling it, they were like, this is the best thing ever, like, blah 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 blah, and patients believe that. And I sent you guys a picture of that, but what people didn't see is when you call that company up, because I called that company, not that I was trying to replace you guys, but I needed more information.
Sus.
And hey, welcome to the new Elias. How you doing? Let me oil him real quick. So it says that there needs to be a doctor there. So the dentist has to be there, and the dentist tells the machine where to place the implant. So why is the dentist not doing the implant himself? What? And they're like, oh no, but this is more precise. But what if he goes in there and the bone's spongy? What if he goes in there and it's not what the CAT scan's 100%? Because can you guys take us to some scenarios where you guys go in and it's not what you guys? Why can't you guys see it in the CAT scan? What's going on? Like, what happens?
So that's the thing about, and you hit it right on the spot, that even guided surgery relies solely and focus on what the CT scan says, but sometimes the CT scans are not as precise because there's sometimes structures that it can not interpretate the way that they actually are. So if you're doing guided surgery, you're pretty much just drilling where you thought everything was, but there's nothing like a freehand surgery where you can actually feel the bone, see where you're actually drilling,
and you can feel the bone density.
Especially if you want to do immediate loads, like where you need to get that torque. And sometimes you thought it was there, and you placed the implant, and you didn't get the torque that you wanted because maybe the machine was not precise, calibered or whatever. and then you have to reposition the implant somewhere else, or longer implant, or when you were doing extractions, that part of the bone broke off, and now, you can't use the guide because you were going to place the implant there, and you got to tilt it. So there's nothing like what a CT scan and everything is. Just gives you an idea of what you're gonna do for a diagnosis. It's gonna give you, okay, I should do this, I should do that, but you should always have a plan B and a plan C. And that's the thing about remote anchorage and full arch, that you need to have everything in your back pocket. Like the patient I saw this week, I was like, I could probably do a palatal approach, but if I can't, I'm gonna need a zygo.
Yeah.
So I have the zygo in my back pocket, but I'm gonna try to do this. Fortunately enough, we were able to do the palatal approach and avoided zygos. But if I didn't get the right amount of torque, I would have gone to a zygo. But you have to have all the tools in your toolbox to do the right surgery.
How many times you need to change the planification?
Oh, a lot of times, yeah.
A lot of times.
So a lot of the assistants tell me before the surgery, what implants should I bring? I was like,
Yep.
I don't know. Let me do it. And what I'm going to tell you right there and then. And that's the beauty about being here, that we have a big stock of implants, and I can just ask for whatever implant I want, and it's there. And but you actually need to be there. Everything's for a diagnosis, to give you a better idea of what you're going to do.
Yeah.
But you need to actually do it. And that's the problem that I see. Oh, I'm going to rant, right? Like an old dentist.
Go for it.
And that's the problem
Have fun.
with the new generations of what I see of younger dentists. I mean, I'm young, but there's younger dentists.
Back in my days.
That
Longer than you. Yeah.
The young dentists are specialists that are just fresh off their specialty.
Software.
They want to do everything guided, and they have
Everything guided. Yeah.
absolutely no experience doing freehand surgery. And to do digital work, you have to know the analogic part of everything. You cannot do digital if you don't know the analogic, because digital bases off analogic. So if you're doing your first cases of surgery all on four and you're just using guides, it's not gonna end the way you think it is. Because if something happens to the guide, then you don't have experience of doing freehand.
But is that based? What you're saying, is that based on opinion, or is that based on facts?
It's based on facts.
Do some facts.
Like if you go to every course where the top doctors are, and it's my opinion, but I base my opinion off what the people that I respect,
doctors.
yeah,
Yeah.
people that I respect that have a lot of experience are telling us that in order to do guided surgery, you need to fully do freehand surgery before you jump into guided surgery. But the newer generations just want to do guided and guided. But sometimes if the printer misprints, if the CT scan is not as precise,
How old are you?
I'm 31.
The newer generation.
New generation. That,
How old are you?
That's true. 34.
Dang, you're 34?
Yeah.
Dang, you're getting old, man. We out with the old.
Yeah. Bye, Luis. So and that's what I see on Instagram. Like you see these younger dentists, and I go like, it's cute. It's cute.
It's cute.
I was there before, but I quickly realized that this is not the way to go.
Finally, the most important for us is the torque, and the torque depends of the technique.
Yes.
If you are using a special technique to put the implant in a perfect position with a perfect torque, is the most important.
That brings me to, we're talking about the all-inclusive promotion that we have. You guys have been there, and this is all-inclusive, which means that if they need 4 implants in the bottom or 6 implants, it's going to be the same price.
Yeah.
And that's even better for us. I mean, how many times have we been in surgery? You guys been in surgery, not me, but you guys been in surgery saying, "Hey, Frank, I thought it was gonna be 4 implants, but it would be better with 6.
With 6, 2 more.
2 more." And what did the patient say? Well, the patient's asleep under sedation. So, and I'm like, "So are you good?" And he's like, "Yeah, I want to do it." And I'm like, "Okay, well then do it." And we don't charge the patient. We let them know, "Hey, we couldn't see this. That's why we're not charging you." And that's why it gets a little bit under my skin when patients say, "Well, you do the switch and bait," which means you say it's going to be this much and we get here and it's going to be that much. No, it's that you come in and we take a look at your CAT scan and then we tell you why what you need is what is needed. A lot of the times less is needed, but unfortunately the ones that need it a little bit more, and they understand normally why because we explain to them thoroughly, then those are the ones that say, "Well, you're just trying to upsell me." No, I'm just trying to make you have a perfect smile or have an amazing smile for the rest of your life. It's going to be your choice. If you're going to go with Bob across the street or in Mexico, it'd be Juan across the street. He's probably going to tell you, "Oh, yeah, I'll do it." And then when it falls off, it's your fault because you drink too much Kool-Aid or something, random stuff. People smoke, people drink, people take medication. There's stuff that happens. But with that comes that we really want the best for our patients. And this goes for everybody out there. If you guys are looking for a clinic, do your research. If you're looking for a clinic that's really going to take care of you, if you're looking for a clinic that, that has transparency, 100% transparency, we're going to tell you why something's needed, why something's not needed, or we're going to tell you what to expect. Now, we're not playing dental gods, because something could still happen because it's medical. But if something does happen, we're going to be there to fix it. And regardless of what the case is, we're always going to look out for you to be your number one priority, believe it or not. This is a business, but it's a medical business. And when the business takes over the medical, it's just a business. So we're going to make sure that whatever decision the doctors and you make, that it's for the best for you. Yeah. Even though we love our patients, we love to see your beautiful faces and your beautiful smiles. We don't want to see you guys back here because something broke or something went wrong. Believe me. So if you're looking for that clinic that's going to tell you 100% how it is and why is it like that and has transparency, 10 international accreditations, and amazing doctors that go worldwide for training, we're your spot. But if you're looking for someone that tells you what you want to hear, that tells you, hey, come down and what's my warranty? Well, we'll talk about it when you get here. We're not that clinic. I'm sorry that I guess in that we cannot be for everyone. We're not here to please what they want to hear. We're here to do what's right each and every time. So with that, thank you so much for being here today, guys.
Thank you for having us.
Anything else you guys want to say before we leave?
No. It's good to be back.
Good to be back. You're about to go where?
Mexicali?
Oh, yeah? That's cute.
Now I'm about to go to Japan.
Oh, is that a place? Is that a restaurant in Mexicali?
It's a Sinaloan restaurant for sushi.
Just in a little restaurant.
Sinaloa restaurant. And so you're gonna be on vacation starting Saturday. You're gone.
Yes.
For 2 weeks.
For 2 weeks.
Second time in Japan.
Second time in Japan. Yeah, it was
I haven't even been to Japan. Everybody in this room has been to Japan, but not me.
And everybody's planning to go
Have
back,
you?
right? Deis is planning to go back.
Oh, yeah.
Luis is planning
Yes,
to
as
go
well.
back.
Yes, next year.
And you're
I'm
gonna
going in
go.
November. I'm going in November. But you guys all been there already.
It was beautiful.
Huh.
It's beautiful.
Yes.
November?
I'm going in November. Yeah, we're going on the week of Thanksgiving. We will be in Japan.
Wow.
We will be in Mexicali, Japan. It's an amazing place. But well, thank you so much, Tejas. Thank you so much for doing this on a short notice.
Thank you, Tejas.
And thank you so much for everybody who listens out there. I'm very excited for what's to come. I know that this time around, the world's a different world than it was a year ago, but we're perfectly fine with that. We're working on becoming even better. A lot of patients come in and say, how can you become better? Your clinic is amazing. Your technology, we walk them around the lab. The 2 people right now as we speak are with a trainer from Spain and TJ in Tijuana.
Yes.
And next month, we're bringing somebody.
Special guest.
Okay, we'll leave it as special guest. From Japan, master degree in ceramics in UCLA.
It's the first phase.
First time he's been to train somebody here in Mexico, coming all the way down to Mexico just to Supremedental Lab. So
Number 1 in the U.S. with a certain company.
With a certain company that we'll talk about that later, and hopefully we'll have him here at the podcast too, so he can tell you all about it. But this has been Supreme Dental Podcast, powered by Supreme Dental, and just like these guys, keep on smiling.
Trying to teach. Talking health. Talking teeth. Supreme Dental. Supreme Dental. Supreme Dental. This the podcast.